Hello and welcome back, everyone. It's 3 o'clock, so we're going to get started quite sharply. If you can, pop on your camera if you feel comfortable, obviously. If you don't feel comfortable, that's fine. If you can pop on your camera just to let me know that you're back in the room, that would be brilliant. Oh, lots of cameras, amazing. Lovely to see all your faces again. Welcome back for the second session of the day. So for those of you who missed the first bit, hi, my name is Sarah Sweeney and I'm Director of Membership and Development at National Voices, and I'm the chair for today's meeting. So as you might guess from the big slide shown at the moment, then you're in the second session of the day, which is focused on developing strong, equal and trusting partnerships between the NHS with people and communities. When we did the kind of gathering feedback on what would be most interesting to this event, this was a very popular one. And so we've got lots of brilliant speakers, hopefully, that you will get a chance to listen to. For this session, we'll be kicking off by hearing a presentation, all of us together in this room, about lessons learned in Mid and South Essex on this topic. And then after that, you'll be asked to choose a breakout room for a session of your choice. Now, if you're like me, you might want a little moment to decide which one you'll attend. They're each led by one of the partners for today's event. So I'll just talk you through those now, and then if you just keep that in your mind so you're ready to choose a breakout room when it comes to that point. So breakout session 1 is led by the Health Creation Alliance by Merrin, who's with us, and it focuses on lessons from Leicester, Leicestershire and Rutland on how to develop partnerships of equals. So we'll be zoning in on that area of the country and learning some lessons from it. The second session is led by SCW, and it's going to be a panel discussion on the ingredients for developing strong, equal and trusting partnerships between the NHS with people and communities. So that includes a connector representative, a voluntary sector representative, and an ICB representative as well. So hopefully will help us to have a live conversation about some of the natural opportunities, but also challenges. And the third and final breakout session will be hosted by Mary Hill at NHS England. And that will be a series of popcorn presentations, so short presentations, no more than 5 minutes from different connector sites across the country. He'll share what they've been doing and key lessons about that. You can find all the details on your agenda if you want some more help with choosing, and then it'll come up on your screen afterwards, and I'll explain all the tech bit to that later on. Before we do kick off with our first presentation of this session, I did want to get a bit of a temperature check of how everyone feels about this topic in the room. So we've got another little Mentimeter slide here. So again, click on the link that we posted in the chat in just a little moment, or you can go to menti.com and type in 26189621, or you can use the QR code. So for some people, the link is working, but like not the QR code. So if one of them isn't working, try one of the other options to try to get into it. But really the ask is, how well do you feel health and care organisations work with people and communities in your area? And there's like a little sliding scale for each of the kind of dimensions where you can go from strongly disagree to strongly agree. And the first statement is health and care services, patients and communities are seen as equal partners. So do you strongly agree or strongly disagree with that, or somewhere in between? Decision making about health and care is transparent and open. Somewhere in the middle. Health and care organisations listen to the voices of people experiencing inequalities, and co-production is the norm. So I can see that the little bars are moving back and forth as more people fill in their views. Oh, and there's another little move across there. So I think, yeah, it is clear that people have, in some places, quite different views. But yeah.
Can you put the QR code back up, please?
Abby, do you want to talk that way QR code up for just a wee second? We'll come back to the main.
Thank you.
Just a second. There you go, Heather. And then back to the slide with some of the results on it. Okay, so you can see that from that for the top two and for the bottom one, there's very few people who strongly agree. But actually it's higher for the third one. So the degree to which health and care organisations listen to the voices of people experiencing inequalities, there's more people agree that at the top end. Most people sit around the 2 or 3 mark. And And the one I think that it sounds like people feel like it needs the most improvement is around co-production being the norm. So thanks so much for sharing that all with us. That's really useful to get a bit of a temperature check in the room. We're going to do that like how people feel from different perspectives, like health and care organisations versus voluntary sector organisations versus people in communities and things, but we didn't want to overcomplicate things. So if you have some particular things you want to share in the chat about why you wrote the work you did, feel free to share that. I think someone might have come off mute with maybe a child in the room. If you can just pop yourself on mute, that would be great, just so we can hear our next speaker. Thank you for that. So without further ado, I'd like to introduce Sophia Morse, who's System Clinical Lead for Inequalities at Mid and South Essex Integrated Care System. And Sophia's going to be sharing their experiences today on what it's like to work in partnerships locally to address health inequalities. Over to you, Sophia.
Great, thank you very much. And I hope you can hear me okay.
Perfectly, thank you.
Okay, thank you. So I am Sophia Morris. I'm coming today from Chelmsford, which is part of Mid and South Essex. I think we can hear cartoons now. Mid and South Essex ICS, which is based within Essex. Next slide, please. So I'm going to be just for the next 10 minutes, just giving you some insights into what it's been like in our Community Connectors Programme, and what the sort of things that our connectors has done, and sort of try to show how we've been working in partnership with our connectors and the wider sort of communities. And as well as just thanking you for allowing me to talk, one of the reasons why I was quite grateful is that in putting these slides together, it's really helped me see just how much we have achieved over the past year in this programme. And I suppose we spend so much of our time wanting to do more that actually I've been able to reflect that we really have done a lot. So one of the reasons why we have this programme specifically, it's called our COPD Connectors, and it very much is a programme which is focusing on a particular part of our system, which is Southend. And within Southend, it's looking at the 5 most deprived wards, and specifically those who have COPD. And it's trying to understand what that lived experience is of living in an area of deprivation, having COPD, and then bringing these people and their stories and their wants and needs into our decision-making rooms. Why we chose COPD is, particularly in Southend, we've got quite a high mortality rate from COPD. It's actually higher than our national average. We still have a high level of smokers within Southend. And there is, when we look at all of our data about admissions for either respiratory conditions or sort of acute episodes of COPD, they are particularly high in Southend, and it tends to correlate to areas of deprivation and those who have poor housing. So there was a real need for us to do this and start to understand how do we better develop the sort of area that people live in and the health services that they're getting for those with COPD. Next slide, please. So one of the first things that we did with our connectors very early on in the programme was to have a number of workshops, and these were facilitated by the Health Creation Alliance, and it looked at how we're going to be working as partners with our connectors, with the people who the connectors come into contact with, and us as the sort of statutory organisations and our wider partners. And it was an understanding that from the very beginning, we need to have a core set of sort of agreements and principles about how we'll work together, how we'll respect each other's voices, and really have a key purpose that actually we want to create change. So we came up with a Connectors Charter, and that charter was developed over a number of workshops. And then the connectors were the ones who got the final sort of sign off as to, was this charter suitable? Did it express what they wanted and what the connectors wanted from the programme, particularly as a programme is voluntary, and these are people who are really committed and have given up their time. So I won't read through all of the principles, you can see them on there, but they're very much about that we'll be working together, that we will listen, that we'll have realistic expectations about what we can and can't do, and particularly that we'll work together to enhance our local assets and networks. And next slide, please. Another really exciting intervention that was put into place and is still running today is a stretch and breathe programme. And what this really was a true understanding about that we often have health services that we think answers the needs of our residents in our communities and those with particular conditions. And what we were finding is that where we had a huge gap about who was attending our pulmonary rehab classes that were on offer for people with COPD. Some people thought that they couldn't access them, or that some people weren't even aware that they existed. But actually, some felt that even if they did go to the pulmonary rehab, it wasn't quite giving them what they wanted. And actually, what they want is something that is more sociable, and probably less about exercise and more just about sort of understanding what it is like to have COPD, and sometimes needing to go at different paces. So a program was put on alongside a community company, which is called Stretch and Breathe. And one of the key reasons why it's called Stretch and Breathe is because people didn't want it to be known as an exercise program. So this program now runs, it's really well attended, and actually we're now looking at how we scale this up and have this in our other areas across Mid and South Essex. And the feedback from this has been, it's been amazing. And we had a video that we put together recently. And a lot of what people talk about is that social connection. So after the stretch and breathe, there's also a little sort of social gathering that happens. And it's having people understand what it's like to have COPD, understand what it's like to live in their area of Southend, and that sometimes they don't have that social connection, and just being able to go to a exercise class or a stretching class really has huge value for the way that they live their life. So this is something that we're going to continue to invest in, but it's that thing about people designing services that fit their needs. Next slide, please. Another key part, as I said, is about understanding what people's experiences are. So we have two pieces of research which are ongoing, and this is what our connectors go out and they encourage people to answer particular questionnaires. So we have an insight questionnaire, and we have an experiences survey, and they are able to do it online, so they can just go onto our SAV's website and do it, or it can be done via paper, so nobody should be digitally excluded. And it really allows us to get some really deep understanding of what people's experiences are. And it doesn't just have to be somebody who has COPD themselves, it can be somebody who is a carer for somebody with COPD, or has a family member who has COPD. And it asks questions about various different things. So you can see on the charts here, it's things like, do you use your inhaler? And we're starting to see that actually some people don't use their inhaler, or they don't know how to use it. So we're now running classes which are about how to use your inhaler, about whether they attend pulmonary rehab, do they have local support groups? Is this something that they would want? And we also have an experiences questionnaire, and what that is, it's very positive, but it's also just trying to understand on a week to week, what are the things that go well for somebody with COPD, and what are the things that they find challenging. So it might be that their access to healthcare services that week has really been a challenge for them. It might be something around housing, it might be transport, and we share this data with all of our partners across the system. Next slide, please. And so one of the key parts about this programme is that we're working across all of our organisations. So the programme itself is actually run by SAVS and partnership with Healthwatch Southend, and they both have different unique qualities within themselves, and as a sort of healthcare NHS, we're also side by side. So we have a key working group which steers most of the programme, and on that programme group it is Healthwatch, it's SAVS, it's the Integrated Care Board, and we have public health local authority. And we're working across different parts of the organisation. So we've had stories where people have expressed issues about their homes. We had a gentleman who had just quit smoking after maybe 40 years, and he expressed how there were issues with his home that were causing him to essentially want to start smoking again. And for somebody who has COPD, to quit smoking, it's a huge thing. And we need to see how can we support people with keeping up these healthy behaviours. So we work really closely with the housing teams. We also work with our homeless charities and some of our voluntary sector organisations that very much are in contact with residents and get a real understanding of sort of where in the communities we need to go to speak to people. The connectors are also invited into some of our sort of more formal meetings. So they have been to alliance meetings. And that's really important for them to understand that they are doing this work in the community, but what they are, insights that they're gathering is being heard, and that they get a chance to come into these decision-making forums and steer some of those choices that we make. And one of our connectors, she's very really activated, so she comes to all of our integrated care board meetings. They send her the papers in advance, you know, and she sits through them and highlights them, and it's amazing. But these are really activated individuals who are even now thinking about the next generation. So they're bringing in sort of younger connectors and saying, how can you help shape services and get your voices heard? Next slide, please. So this just gives an overview of what our programme outcomes have been to date, and that I hope we'll continue to see in the next year that we will have. So for the next year, we'll be looking at chronic respiratory conditions, and we'll also be looking at how we can share some of our learning that we have from our 5 wards across the wider Southend area, and also looking at other alliances, so other localities, how they can sort of use the model that we have to put this sort of connector programme for other conditions. So this sharing of insights has been invaluable. There's been stories that we've heard that I don't think if we had this programme we would hear, or maybe we would probably hear about it a year down the line. So it's some really sort of on the ground, quite quick turnaround of information that we're hearing. Our connectors also, they have just become so much more confident in what they're doing and about their place in the communities, and really starting to see themselves as community leaders. And generally also we do lots of interventions. So all of the big sort of COPD days, we're going out and really increasing the awareness of COPD and what it, you know, how does somebody live healthily and well with COPD, and that it doesn't have to be a devastating diagnosis. Also thinking about how we align some of our work with other conditions. So we do things like hypertension case finding. So when we're going out doing outreach with those services, that actually we bring them together. So it becomes a lot more of a sort of multi-morbidity approach, and then we are working together with all of our partners. And next slide, I think that's the last slide actually. Thank you.
Sophia, thank you so much. It's really interesting to hear about what you're doing. It sounds really fascinating, and it makes me really excited, even more so for the next breakout, just to hear about other systems and what they're doing. So thank you for sharing that. And so yeah, now is the time for breakout groups. So just for a recap, breakout group 1 is lessons from Leicester, Leicestershire and Rutland on how to develop partnerships of equals. Breakout group 2 is on a panel discussion on the ingredients for developing strong equal interest and partnerships between the NHS with people and communities. And breakout group 3 is a series of popcorn presentations from connector sites sharing what they've been doing and key lessons. We're running just a few minutes behind, so we're also going to come back from breakout groups a few minutes late. So breakout group chairs, we'll put you back into the main session at 3:43 now instead of 3:40. And I think Pavi, who's our tech whiz for the day and has been troubleshooting the different problems we face, thank you, Pavi, is going to open up the breakout group rooms in a moment, and you should be able to choose which group you're part of, unless you're a speaker, in which case I think you'll be allocated. And the way that looks on people's phones or on their screens is a little bit different for everybody. But yeah, it should either I think, pop up on your screen, or you might have to press on 3 dots in the corner to access breakout groups. But Des will be staying in this main room. So if you're not quite sure how to do it, she'll help people to troubleshoot and to join the rooms. Patty, have you opened those yet? Fabulous. Something's popped up for me now.
Breakout rooms are open for everyone. If you're accessing from your phone, there'll be 4 little boxes in the top left corner saying breakout rooms that you can click on and then select which room you want to go into. Otherwise, I think there should be a pop-up on the screen.
Fabulous. See you on the other side.